Hey everybody, this is Dr. Daniel Choi here at North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center, and I wanted to talk about All-on-4 and how you basically take care of it to make sure that you have these inside your mouth for the rest of your life. Now, if you already have All-on-4 or you're considering about getting it, congratulations. I honestly think it is the best option and economical option to basically be able to replace all your missing teeth, or if you're already missing a few teeth or you have teeth that are going to go bad. I really think that it is just such a great product. I tell people that it did to the taxi industry what Uber did. And I just think it's such a revolutionary product. I've seen so many patients that are happy with it. However, as great as it is, there still is maintenance associated with it. So how do we basically take care of it to make sure that we don't develop any longer term issues? Because again, it is an investment that you want to have for the rest of your life. But again, how do we take care of it? So basically, I'm going to break this down into two components. All right. So after you've had your surgery done and those first few months, how you take care of your interim prosthesis, and then after you've had your final prosthesis and how you take care of your prosthesis after that point. Okay, so let's start with day one. Day one, you go in, you have your surgery. We take out your teeth, or maybe you're already missing your teeth, but after that, we smooth out your bone, we place some dental implants, suture you up, and then we screw this part, the prosthesis, on, right? So this is gonna be your interim prosthesis. Now I talk about this in other videos, but at this point you gotta be real careful. You wanna make sure that the office that you go to, because there's a lot of bait and switching going on out there, that prosthesis that you're going home with that day one is not gonna be your final prosthesis. You definitely want to make sure that you let that heal probably at least 4 months, maybe even 5 months before they start putting your final prosthesis. Otherwise, you're going to start developing all these other issues. And again, I talk about that in other videos. But going back to the point, you had your surgery done, you're going home, and these teeth are inside your mouth that day. Now, how do we take care of your teeth from day one after your surgery? Well, you're going to be pretty sore. We're going to have you take your antibiotics. We're going to have you take your pain medication. We're going to have you rinsing with salt water 3 times a day. And we still, even though that this prosthesis is impervious to any bacteria that cause cavities or anything like that, we still want you to keep it clean because we don't want bacteria to be building up on your prosthesis. So the way you do that, we're going to have you brush with the soft toothbrush with non-abrasive toothpaste to make sure that stays clean. At the 1 month mark here at North Texas Dental Surgery, we have you come in. We take x-rays. We want to make sure that you're healing well. The implants are doing well. And also, we are actually going to unscrew this prosthesis off of your implants. Okay, so you can actually see those tiny little holes there. Now, those are going to be completely covered up, but we will take those, we will uncover those holes and then unscrew those tiny little prosthetic screws, take this actual prosthesis off that replicates your gums and teeth, and then we're going to send that through the ultrasonic cleaner. Now, on those underneath, like poking through your gums, you're going to have what we call these little multi-unit abutments. Those multi-unit abutments, we're going to clean around those, make sure that there's no bacterial buildup around there, any plaque buildup, make sure that's nice and clean. After your prosthesis is cleaned from an ultrasonic cleaner, we're going to screw that back into your dental implants, and then you're going to go home. Now, one thing that I'm going to introduce at that point after the 1 month mark is I'm going to make sure that now you're going to start introducing the water pick, okay? So we want you to use a water pick because that can get into any sort of nooks and crannies and get rid of any bacteria or buildup underneath there. So you're going to make sure that you do that for the next few months. At the 3 month mark after the surgery, we're going to have you come in and we're going to do exactly what we did at the first month appointment. We're going to take off this prosthesis again, clean underneath it. We're going to send this through the ultrasonic cleaner. After that's all done, we're going to screw this all back in, and then you're going to leave with your teeth screwed in. At about the 4 month mark, if you're healing great, the x-rays look good, and keep in mind again, every time you've been coming in, we've been taking x-rays to make sure that these implants are healing well. So if those implants are looking great, then we're going to get you set up to put you in your final prosthesis. Now, this is where it varies from office to office. Now, here at North Texas Dental Surgery, again, we talk about this in other videos, but we only put our patients in a zirconia prosthesis because it is just such a more solid material. It's beautiful. It doesn't attract bacteria. So a lot less longer term issues versus a titanium, PMMA, acrylic prosthesis. Any sort of prosthesis that they want to put you in your final that's made of acrylic is going to be more prone to attracting bacteria, which is going to be an issue. because underneath the prosthesis, if bacteria starts pulling up underneath there near your gum area, that can cause to longer term issues. In worst case scenario, even implant failure. So I'll even show you a 3D scan of a patient that came in to my office 10 years after having a prosthesis done and she never got any cleanings. And I'll show you that at the very end. Now, basically, again, like here at North Texas Dental Surgery, we only do the zirconia prosthesis. So let's say it's about 5 months, 6 months later, after the surgery, you're now in your final zirconia prosthesis. Again, we love zirconia because how resilient it is, and also how on a microscopic level it doesn't want to attract bacteria. Again, it is so much better for your tissues, your gums, causing less inflammation, and less inflammation avoiding, what we call peri-implantitis and ever having any implant issues. But again, there is also the other option out there that we don't do here, but it's called a PMMA. It is an acrylic prosthesis that is essentially plastic. Well, the problem with these acrylic prosthesis underneath is that it's going to attract more bacteria, and the more bacteria that it attracts is therefore going to potentially cause more issues to your dental implants in the long run. And that can cause something called peri-implantitis, which you definitely don't want for your all-on-4 prosthesis. So not to scare you with this, but again, just be informed that you need to make sure that you do a really good job of taking care of your cleanings, brushing twice a day, rinsing, using your water pick, and also going in to get your prosthesis cleaned once or twice a year at least. Now, how often you get your prosthesis cleaned really depends on how much bacteria you're attracting underneath there. So everybody's different. Again, here at North Texas Dental Surgery, we only use zirconia prosthesis, so we never see much buildup underneath there, again, due to the inherent properties of zirconia and how little bacteria wants to attract. So let me actually even show you a photo real quick of what a PMMA prosthesis or an acrylic prosthesis can attract bacteria. So here was a patient that came to my office and she wanted recommendations. She wasn't happy about the prosthesis that she had done, and some things I see right off the bat is that they made her a little gummy, probably due to not enough bone reduction. Also, the shape of the teeth she wasn't happy about, symmetry, comparison to canines, etc. But I'm looking at this right now and I see, okay, all this bacteria buildup, and so we're seeing all this plaque and tartar bacteria buildup on this PMA, this acrylic prosthesis, whereas zirconia would have the inherent properties of not allowing for this to happen. So if this buildup is occurring on this prosthesis here, what's happening on the underside of this prosthesis when the prosthesis is actually in contact with the gums? So on a patient like that, I would definitely want to make sure that she's coming in more often, and also be more, tell her in regards to she probably needs to exercise better oral hygiene, because again, she made a very large investment with whatever office that she had her all-on-4 done. But again, that was why we don't do zirconia prosthesis here. Now, so to kind of sum it up, how you're supposed to basically take care of your prosthesis is, again, there's this post-surgical component where you basically, after the first month mark, up to the first month mark, you're going to do a lot of saltwater rinses. You're going to brush your prosthesis. After the first month appointment, the follow-up appointment, the post-op appointment, what we are going to then have you introduce is using the water pick. Again, you don't want to use a water pick before then, and make sure you do that. And then after that appointment, up to the 4-month mark, you can use, again, water pick, saltwater rinses, cleaning your prosthesis. And then after you're putting your final prosthesis, you're then going to go see your dentist, maybe once or twice a year, depending on what type of prosthesis you have, how often you get buildup. And it is, again, very important that you do these cleanings to make sure that you don't get bacterial buildup there that's going to cause issues with your dental implants. Now, let's talk about a case where a patient came to my office. She had an all-on-4 done about 10 years ago. She had one cleaning during that time. Now, this frustrates me because, with me and my office and my patients, I'm always emphasizing we got to make sure we keep these things clean. You made a very large investment for your future confidence, your ability to chew. But I think so many offices get kind of in this, mindset of, hey, we're going to do the all-on-4 on the patients, and it's like, one and done, and I'll see you later, and, just call me if you ever have any issues. But, one way that we can avoid issues is making sure that we do a really good job of taking care of them at home, and also coming in once or twice a year to make sure that we do a good job of cleaning it. Now, unfortunately, this patient didn't get the emphasis to make sure that she did a really good job of taking care of it. So let me show you what it essentially looked like. So here we have a patient, again, she had her implants, 5 implants for an all-on-X prosthesis on the lower jaw. She had a regular denture up top, but you know, again, she had an all-on-4 on the lower. She was so frustrated with her previous denture, but she had these 5 implants placed 10 years ago, but the surgeon really didn't emphasize that she needed to make sure that she did a really good job of keeping this prosthesis clean. And so she had one cleaning over 10 years. She came to my office complaining about pain and soreness going on down here. And so right off the bat, I could see an extensive amount of bone loss. And then what we see when we look at the 3D scan, on this 3D scan, you can see that this patient has lost, from the side view, a significant amount of bone around the dental implant. So unfortunately, she lost this implant and this implant. And in fact had lost so much bone she almost fractured her jaw. So it was very unfortunate that her surgeon did not stress to her the importance of making sure that she got her cleanings like once or twice a year, and also giving better oral hygiene instructions at home. So just to let you guys know, I use that patient's example as a just again as an example to show what can go wrong with an all-on-4. Getting an all-on-4 doesn't necessarily mean this is something that you're paying for. You never have to worry about your teeth again. It is, again, a great option, a much more affordable option than doing individual implants. But it is something that you still need to make sure that you do a really good job taking care of. So hopefully you guys found this information to be very helpful. If you guys have any questions, please feel free to leave any comments below, and I will make sure to follow up. And if you guys have any questions and you want to be seen, please feel free to come in for a consultation. Glad to help. Thanks.